hold on a second, I'm a little out of breath. I saw this doctor 2 years ago. When I came into the office, I let him know that I was in an abusive relationship. It was actually the cause of the visit at the time. That visit, let me stick to the main thing.
What are we here for today?
That. So, when I saw the doctor 2 years ago, I let him know that I was in an abusive relationship, gave him the contact info of the abuser, and then he billed the abuser, and then has just basically ghosted me. And the abuser is using the fact that they paid for that visit to further kind of inflict abuse. And for some reason, he doesn't want to answer. He's not giving any kind of information as to what's going on.
Do you have an appointment with this doctor?
Like I said previously.
Okay, what about today?
I've been trying to make an appointment. He's not even answering. That's what I'm saying. Like, he's acting as if I've never been a patient. They're not responding to emails. They're acting as if it's not an urgent situation currently. Because right now, his lack of answering is preventing me from being able to get any help. Both.
What kind of help do you need?
Well, one for the abuse, but also for my health situation. Because since he's the first doctor I saw for my my heart failure, he wrote a prescription that nobody else can read. And my current doctors don't know what his intent was by that prescription. And so I can't even get medical attention from other doctors because of it. So I don't know what's going on, but I do know that
So you're saying this is the doctor's office that you usually come to?
Yeah, well, yeah, exactly. But I do know that there's something wrong with him billing, not me, number one, but also, billing the abuser. He literally, I gave him the contact info because this person's abusing me, and then he bills them. And then as if there's nothing going on.
Okay, so you want the bill to go to you?
It's not just, again, this is an abusive situation. First and foremost is that. It's really just, that's number one.
Who's the abuse from?
Currently my mother.
Your mom in Tampa?
Yeah. Exactly. So this is the thing. You seem to know, you have information.
Yeah, I've dealt with you before.
So then, I don't remember you. Oh, yeah, I do. Wow. Wow. I'm sorry. I remember you. You just look really different than what I remember.
Okay.
So that's exactly the situation.
So what do you want us to do for you today?
Well, find out what's going on with this doctor what's going on? Okay. Because billing somebody...
Take a seat and I'll talk to them, okay?
Because billing someone is very odd.
Just take a seat and... Okay, Charlie, so the doctor that you're referencing, what was his name?
Dr. Savage.
Okay.
They're not even giving any info.
Let me talk, please.
Sure.
So the doctor is on vacation. He's out of town. So you can't express your concerns to that specific doctor at this time.
Mm-hmm.
There's only one employee here who she wouldn't be the one to talk to about.
No, I understand that. I'm just trying to get an answer.
I said, listen to me. I'm giving you an answer.
Okay.
Stop interrupting me. So, also the manager who deals with records, such and such as billing.
Uh-huh.
So the bill
that's what I was trying to get to.
That keeps going to your mother in Tampa. That manager is not here as well. So today, today is just a bad day to like get the information you want, right?
Uh-huh.
But also, apparently that bill keeps getting sent because it hasn't been paid.
See, they haven't even said that. That's one of the reasons I've come here so many times.
Okay, so
because
no need to get all worked up over it. It's a simple misunderstanding, but you just need maybe call here next week when the manager's here and talk to the manager. It's that simple of a solution.
I've tried. I've called. I've emailed.
Okay, well they seem like reasonable people here. So if you just call and say, hey, how can I pay this bill so it stops getting resent to my mom?
Okay.
Tampa? That's all you have to do.
No, I understand that, but that's only what seems to be weird is that what keeps getting disregarded is that my mother either is being extremely abusive or has mental health issues. When he spoke to her, that's kind of the whole weird thing. When I came here specifically and said, I'm in an abusive situation. I had heart failure at the time. I was afraid to go to the hospital because of my mother. That's how horrible a situation I was in. Okay. As far as I know, they're supposed to report it. I don't know whether he reported it or not. It is an issue because subsequently, all the other doctors I've seen afterwards, they seem to believe that I have never reported or have tried to get help for the situation I'm in. You, as you said, you've dealt with me previously. My mother has now, 2 days ago, my mother spent the entire day calling me, unable to control herself. I don't know why she can't control herself. I can't call anybody for help. This guy actually knows for a fact that she has been abusive, that I came here to report it, and the lack of him being able to even just confirm that or give any answers as to why he didn't report it, just like the fact that you didn't report it back then as well.
Don't talk about last time I dealt with you, because you tried to report something and then you became uncooperative with us and told us to leave your residence. So we did. Okay? So I'm not going to stand here today and keep going in circles.
I'm not arguing with you.
Listen, you need to leave because there's no business for you here. You can't go behind the counter and scare this woman. Okay? So if you want to talk more, we can go outside and talk. But your business is done here today. Okay?
Okay, so
Did you hear what I said?
I understand that today.
Okay, then get up and let's go. Let's go talk outside.
Okay. So, as you said, is she going to reply to the email? Or
outside.
Okay. So, as you said, they're going to reply, or they're not here, they're on vacation. You said next week. You take the elevator or the stairs?
It's just one story.
Cool.
If you obviously didn't have a good reaction with that doctor, why would you want to go back to the same doctor? Why not just go to a different doctor and move on?
Because that doctor's responsibility was to complete a task. There's two things involved. One is my medical health. Again, the doctor wrote a prescription.
And you should want to go to a different doctor to have optimum medical care.
I have a medical.
This doctor, and you obviously feel as if he did not do stuff for you.
I have a medical history with him. I need to at least be able to. A very big appointment. An appointment that determined that I had congestive heart failure. A very big appointment, not just a checkup.
I don't know if congestive heart failure has to do with him being responsible for your issues with your mother.
Do you need any medical assistance? Can we request anything for you today?
No. What I do need to understand though, because I do need to get an answer at some point in time. It doesn't just kind of go away with no answer.
An answer for what?
Again.
For which
one,
issue?
why he did not report the abusive situation, number one. Number two, why is he even trying to bill my mother when he was told that she was the abuser? It doesn't make any sense.
Well, I don't understand how their record keeping works, but I mean, you were the one that came here, so you were the one that must have given them the contact information for your mother, right?
As I just said, because she was the abuser, he asked me
Okay, so
for
I don't
the
know,
information
there's some
as the
type of
abuser.
misunderstanding there, and the people that handle that are not there today. So there's nothing we can do about some paperwork, some bill that's going to Florida. You can't sort those things out without the correct personnel there. So
No,
And if you would like to take care of the bill, you could have just called in on the phone.
I have previously
for-
many times.
You could just call in on the phone, give them your name, and pay for the bill. If that's
I have previously many times. Again, the bigger issue again is that currently, right now, 2 days ago, SFPD showed up at my
I
house.
was at your house. I was at your house. I know
2 days ago.
exactly what happened.
hey, so look, I have some advice you might want to take.
Really?
Charles,
I was at your house. I know exactly what happened. So,
Charlie,
Yes.
if you want this issue to go away, just call them, be direct with them, and just pay the bill. You don't have to give them a whole story. Yes, you might be unsatisfied with
Thank
their
you for your
customer
advice.
service,
Thank you for your advice.
but just be direct with them. Say, hey, I'm calling to pay my bill. My name is this. Here's my credit card number. This. Done. It's easy. You don't have to go around about circles.
I
and
have
then
tried
scared
that.
lady in there. No.
Thank you for your advice. I just wanted to
Okay.
let you know I've tried that. Maybe
All right.
listening
Please
skills.
don't go back there today. Call
I
next
won't
week,
go back
okay?
there today, but thank you for your assistance today.